Hello and welcome to Council Connection, together strengthening our communities. I'm Council Chair Dannielle Glaros. The Prince George's County Council also serves as the county's Board of Health. Change is coming to healthcare in Prince George's County, and my guests will provide important updates. So stay with us for the good news. This is Council Connection, together strengthening our communities, comes your way in just a moment.
When you're making a decision as a consumer, the most important thing is trust, which is why the BBB is such an important tool. Sometimes a new company will generate a lot of buzz, but that doesn't mean they're trustworthy. There are places that pretend they're treating you like kings, while behind the scenes they're making you look like a clown. But with BBB, if you spot false advertising, they're there to help you blow the whistle. Or if you've got a complaint, file it with the BBB and they can actually help you get it resolved. The BBB, protecting consumers for over 100 years.
Welcome to Council Connection, together strengthening our communities, a Prince George's County Council production. Working together, we are making tremendous progress in our county to ensure that we have quality health care, solid transportation options, jobs that pay well, a strong neighborhood quality of life, high-performing schools, and successful local businesses and neighborhood centers. It's time now for Council Connection, together strengthening our communities, with your host, Council Chair Dannielle Glaros.
Hello, and thank you for tuning in to this edition of Council Connection, together strengthening our communities. This program is a production of the Prince George's County Council, and I'm your host, Council Chair Dannielle Glaros. Access to quality health care is a top priority here in Prince George's County, and the new medical center under construction is set to open in the year 2021. And there have been changes at the facilities in the cities of Bowie and Laurel as well. The University of Maryland Medical System, or UMMS for short, is a new healthcare partner in the county. And joining me today to discuss this new relationship and what it means for improved healthcare delivery in Prince George's County is Dr. Michelle Gourdine, Senior Vice President for Population Health and Primary Care at UMMS. Thank you, Michelle. I'm so delighted to have you here. You're such a nationally sought-after speaker and author, dedicated to empowering people to make healthier choices for themselves and their families. Welcome to Council Connection, together strengthening our communities.
Thank you. Pleasure to be here.
A pleasure to have you, Dr. Gourdine. Michelle, as you said earlier.
Yes.
So you have a pretty fancy title, Senior Vice President, Population Health and Primary Care at the University of Maryland Medical Systems. What is that? What does that mean? What are you doing?
So in short, what that means is that we are working in the medical system, and certainly with the new hospital coming up in Prince George's County, to make sure that the individuals who we serve, both in the hospital and in the community, get the best health care possible to make sure that they remain healthy. So focusing not on disease treatment, but also on wellness.
And last November, we broke ground on the future site of the University of Maryland Capital Region Medical Center at Largo, at our metro station. How's the project going? When do you expect it to be completed?
All is going very well. In fact, I just passed the site today, and there's a lot of activity going on, a lot of machinery and cranes and so on and so forth. And so, yes, we're hoping to open the new facility sometime around the spring of 2021, and we're very excited about it.
And I know when we were looking at sites here in Prince George's County, there were a lot of sites under consideration. Why Largo? Is there anything in particular about Largo that led you to that location?
Well, you know, from what I've seen, and I was not involved in those discussions, but what I've seen about Largo and about the location where the hospital is going up is that it's surrounded by community. Certainly also has the opportunity to bring in other amenities. We hope that, you know, other businesses will be attracted to build there and create sort of a very vibrant center where the hospital perhaps is the anchor, but perhaps there are other supportive businesses that might want to join in that area and create just a more strong and robust community to promote health care.
We really think of Largo as our downtown now in Prince George's County. We've never quite had a downtown. We have a bunch of different neighborhoods and communities and cities. And it is really exciting to see Largo really with the anchor of the Regional Medical Center coming out of the ground. We already have a tremendous anchor there, the Prince George's Community College, which is just going to be a little ways away from you. Talk about some of the services that you anticipate will be in the new Regional Medical Center.
Well, as you know, the University of Maryland Medical System is a university-based health system, and what we are going to be bringing to Prince George's County and to Largo is top quality medical care. We're talking about a level 2 trauma center, which is the second highest level of trauma care that you can find anywhere. Level 3 neonatal intensive care unit, which has great specialization in taking care of preemies, cardiac care, stroke care, emergency room care. So the full spectrum, cancer care as well, the full spectrum of services that provide top-notch, top-quality, world-class care will be coming to Prince George's County.
That is absolutely wonderful. And already some of that is here in the county.
Right.
So over in Cheverly, where the existing hospital is, you all are already transforming the care services and the delivery of services over there. Can you speak to that?
That is absolutely right. We are already there, and we're already working with staffing there, bringing in additional staff to begin to deliver that same type of world-class care that we want to transfer into the new facility. And so in terms of trauma care and stroke care, cardiac care, so on and so forth, those services are already there. And we're placing sort of the stamp of the University of Maryland medical system onto those services. And we expect that certainly the services that are provided in Cheverly will be at the same level of quality that they'll be when we move to Largo.
That's really exciting. And I think that's exciting for all of us here in Prince George's County. So many of us do go outside the county
Right.
for our health care services. I know that was the case when I was pregnant. I delivered at Georgetown Medical Center, both my kids. And our pediatrician actually recommended that if we had emergency care and we need emergency care to go outside of the county. So I just think it's so exciting for us here in Prince George's County. We're on the cusp of delivering great quality healthcare services.
I think that's right, and I'm glad you brought that up because we believe that the residents in Prince George's County, after all, this is the second largest county in the state of Maryland, that this county deserves high-quality health care close to home. And so what we want to create is a healthcare system, a healthcare community, where people who live in the county no longer go to Georgetown to deliver their babies and no longer go outside the county to seek health care, but stay right here at home and get that same quality that they think they had to leave the county for, get it right here close to home. And so that's what we are planning to deliver.
And already you're engaging with our communities, I know with our civic associations. I know I've gotten a few mailers from the University of Maryland medical system keeping us in the loop on what's going on. Talk more about how you're engaging with our residents here in Prince George's.
We believe that communication is very important. And so, you know, the first thing we want to do is to let people know we're here. We're in the community and we're here to serve you. And it's so important to help people understand exactly what types of services they can expect, both at the Cheverly site and at the new Largo site. And so being specific about that, sharing stories about individuals who've received care at the Cheverly site, positive stories about their positive experiences. And, you know, people are noticing a difference already, and we have not been in that facility for that long. And so that communication piece is very important. But not only that, working with elected officials like the county council, as you know, we came out and we did a presentation there, and we plan to continue to remain in touch because the council, of course, is the Board of Health, working with the health department very closely. We have a task force now made up of community leaders that is working to develop a network of primary care, integrated primary care and behavioral health that will deliver care primarily outside the hospital walls. So we're focusing on getting out into the community, making those real connections, you know, and we go beyond just traditional healthcare providers. We're looking at working with the faith community, the business community, and so forth. And so we are very dedicated to and already are sort of walking that walk and talking that talk about being about the community in Prince George's County.
It was really exciting. I was at a community meeting just a few months ago, and one of the gentlemen in the audience, I was taking a bunch of questions, and he raised his hand, and he shared his experience actually at Cheverly with the University of Maryland medical system, and he had had a heart attack actually. And so he really talked about the delivery of care services, and he was just so proud of the service and the quality of delivery of services he received. And a lot of people, once again, in the community didn't really realize already University of Maryland medical system has a presence here in Prince George's County. And I just think that's so important as we transition into the brand new hospital that will be taking, which will be happening hopefully in 2021 as that center comes on board. You mentioned a bunch of the services that are coming on. I know that one that we've been talking a lot about here in Prince George's County is around mental health. Can you talk a little bit about some of the mental health services you're also going to have in that center as well?
So the mental health services are extremely important. important. As we all know, mental health issues are pervasive and unfortunately sometimes underdiagnosed. And so that is one of those areas where we're definitely working with the community, attempting to pull together existing community-based providers, working with the health department, which is a great resource in that area as well, but also bringing expertise from our Department of Psychiatry at the university level to be able to create a community-based mental health full spectrum of services. Some of those services will be delivered at our Prince George's County Hospital. Some of them will be delivered at our Laurel Center as well. So we're very excited about that comprehensive spectrum of care that we're going to be able to provide in the mental health arena.
So Dr. Gourdine, I do have to ask you about your book, Reclaiming Our Health, A Guide to African American Wellness. Talk to me a little bit about your book.
Sure. The book, Reclaiming Our Health, was published back in 2011. Yale University Press was the publisher. The purpose of the book was to be able to provide information and almost a playbook of sorts to the African American community, because one of the things that I noticed when I was practicing medicine for many, many years was that, you know, the same types of conditions I was seeing over and over again in the African American community, high blood pressure and heart disease. So in addition to getting good medical care, what else can we do for ourselves to be able to improve our health? And so it's been something I've been very privileged to be able to go around the country speaking about and promoting, and of course we're going to be incorporating some of those principles into the care that we deliver through the University of Maryland medical system as well.
Well, I'm just so excited to have you as part of the team with the University of Maryland Medical System. I was saying earlier, I was thinking you had been on board for a year. No, it's just 5 months.
That's right.
You're a practicing pediatrician, and so you bring that expertise here to Prince George's County and this expertise to the University of Maryland Medical System as we launch this new medical center, which is just ecstatic, and we're all excited for the opportunity.
It is extremely exciting, and it's just a privilege to be a part of that team.
Well, thank you so much for being here today. Really appreciate you joining us for Council Connection.
My pleasure.
We'll take a short break, but stay with us. We'll return in just a moment for a discussion about overall health policy here in Prince George's County with my next guest, Dr. Joseph Wright, consultant to the Board of Health. Council Connection, together strengthening our communities, returns right after this.
My name is Chris Borland. I walked away from pro football and a $2.9 million contract with the San Francisco 49ers because I didn't want to develop CTE, or chronic traumatic encephalopathy, which is caused by repeated brain injury. Researchers at Boston University studied the brains of 111 deceased NFL players. They found CTE in 110. CTE is a brain disease that causes depression, aggression, dementia, and in some cases, suicide. Yet for many years, the NFL denied the link. Unfortunately, the NFL isn't the only powerful player that's sidelining science. Lobbyists in many industries are paid handsomely to convince lawmakers to undermine science that protects our health. We all need to speak up and make sure that science isn't sidelined. Because when powerful interests keep science from the decision-making process, people get hurt. Join with me today to become a science champion. Our health and well-being depend on it.
Stop. Whether it's on the way to school, at school, or online, bullying has become a non-stop threat to our youth today. Is your child being bullied? The National Runaway Switchboard can help. If you're having a hard time, get online or call to chat now.
Welcome back to Council Connection, Together Strengthening Our Communities, a production of the Prince George's County Council. I'm Council Chair Dannielle Glaros, your host. With me now is Dr. Joseph Wright, Professor and Chairman at Pediatrics at Howard University Hospital. Dr. Wright provides national leadership through advisory and governance service to several organized medicine bodies. And I am really proud to say he serves as the consultant for the Board of Health for the County Council. Thank you so much, Dr. Wright, for taking time out of a very busy schedule to join me for this edition of Council Connection, Together Strengthening Our Communities. Dr. Wright, thank you again so much for being here today and for taking time out of what is actually a really busy schedule I know you have. Talk to us a little bit and share your perspective. You've been the consultant for the County Council's Board of Health for many years now. Talk to us a little bit about the role of the Board of Health here in the county and how that really has evolved over the years that you've been consulting with us.
Thank you. Thank you for having me. But it's actually only been 6 years.
Only 6 years.
Yes, that I have worked with the County Council in their Board of Health function. And that's significant because in this administration and with the council leadership, there's been a heightened emphasis put on health and healthcare. And the county's legislative and the county council's legislative function, it really has taken a leadership role here in county government with regard to health policy and what I'm most excited about, a real voice advocacy on behalf of the residents of Prince George's County in terms of heightening awareness about health and healthcare.
One of the things you talk to us a lot about as county council members is the social determinants of health. Share with me more about what are the social determinants of health? What are the key factors that you're looking at here in this county?
Yes. Simply put, the social determinants of health really speak to those aspects of family life, of community life that contribute to the health and well-being of not only individuals, but to a community. And what I emphasize with the County Council is that the actual provision of health care, like in a doctor's office, is but a small part of what contributes to health and well-being. And the County Council, in their broad role, has domain over all aspects of contributors to the social determinants of health. And I often speak to you and your fellow council members about health in all policies. And certainly all of the policies that you consider and that you have responsibility for have contribution to health and well-being.
So just a few weeks ago, we had a Board of Health meeting, and you shared with us the latest health rankings for the state and for Prince George's County. And we definitely have seen improvement over the years. We still have a ways to go in a bunch of categories. Talk to me a little bit about where you see us now versus where we were, and what do you see as our trajectory?
Yes. Well, the trajectory, the great news is that the trajectory and perhaps the most important global metric, life expectancy, has been rising. In fact, the county has experienced an increase of life expectancy of 2.5 years over the course of the last 5 years, which is a huge, doesn't sound like a 2.5, doesn't sound like a big number, but in the grand scheme of things, it is a big number. And the great news is that it's heading in the right direction. And the future looks bright because all of the policies and developments around healthcare that promote the growth and emphasis on those things that we talked about, the social determinants of health, are being implemented. And so I expect that we should continue to not only see increases in life expectancy, but the metrics that most people look to that define a jurisdiction that emphasizes and prioritizes healthcare.
And we were just talking to Dr. Gourdine earlier. We're really excited to have another health partner here in Prince George's County, University of Maryland Medical System, a pretty substantial health partner. We've also seen a growth in more, I would say, health facilities opening up here in Prince George's County. So we had La Clinica open up over in the Hyattsville area. We're incredibly excited about Children's National Health bringing a substantial building here here to Prince George's County over at the Woodmore Town Center. So we are seeing this growth in our network as well. Speak to me a little bit about what you think are sort of the key aspects or the key items we really need to hone in on and focus in on as we substantially improve our healthcare system here in Prince George's.
Well, as you mentioned, many of the providers and healthcare systems who have served our population for many years, La Clinica and Children's National Health System being but two, have served our population out of the county.
And now they're coming in.
And
it's
now
exciting.
they're coming into the county, which is very exciting. And I think it speaks to the fact that we have emphasized the importance of providing services here at home in the county, and these systems and providers are responding. And we've had them all down, as you well know, to the County Council as part of Board of Health work sessions. And I expect that we will continue to invite providers and those who are interested in working with us down to the council to share their vision.
And one of the things that I know you do on our behalf, you sit on the board for the University of Maryland Medical System, this transition board that was established. Talk to me about what having the University of Maryland Medical System here in Prince George's, what does that really mean? How is that going to change and improve our healthcare and healthcare delivery in the county?
Yes. So I've spent my entire professional life in academic medical centers, a long time at Children's National Medical Center and now at Howard University College of Medicine. And what it means to have a well-respected academic health system come into the county is that you have the cutting-edge knowledge base with regard to the providers. You have the cutting-edge delivery systems and the equipment, and it simply means it raises the quality of the care that we can expect here in the county by working with the University of Maryland Medical System through the Capital Region Health. I still have to get used to the new nomenclature, but working with the Capital Region Health System here in our county. And I really think it just raises the bar all the way around.
So one of the things we also talked a little bit about at our last Board of Health meeting is what do we need to do next here in Prince George's County? We have a tremendous new partner here. We have other partners, as we discussed, that are moving into the county to serve populations of people here in the county. But we also want to make sure that we are making sure we have a really good foundation here in the county and that we are using our county dollars. We've always been pretty lean, I would say, in terms of our work in the health, social services, and human services. We do a lot with the dollars we have, but really you need to invest a little bit deeper. And one of the data points that struck me from our presentation just a few weeks ago and still is in my head is about our mental health providers here in Prince George's County. Our number of providers per our residents is just incredibly low compared to the rest of the state. What do you think we need to do? What's your thoughts on that as we sort of grow our healthcare system in the county and really improve the delivery of services?
Yes, this is really the most important question on the table right now. The agreement around the hospital was one that was focused on a hospital, a brick and mortar building. We've already talked about the advantage of bringing academic health identity into the county. But the third arm of the agreement was to build a network, to build a primary care, and which includes a behavioral health network. And I think to your point, investing in that network and building the provider base, particularly around mental health, is the next critical step that needs to happen. And it's time sensitive. This needs to happen before we go into the new flagship hospital there in Largo.
So we have a good 3 years, in essence, to make sure that we're really strengthening and focusing on this primary healthcare network here in the county. One of the other things you talked to us about at that Board of Health meeting a few weeks ago was what's going on in South County. And I really want to mention that as well, because it is really exciting to hear about this medical pavilion that's coming out of the ground at National Harbor. It's a model I hadn't seen before. So can you talk a little bit more about the medical pavilion at National Harbor?
Certainly. The medical pavilion at National Harbor is actually a private sector health facility that actually broke ground a year ago and is expected to open their doors within the calendar year 2018, which is lightning speed, and is a multi-specialty, including primary care, by the way, mix of providers in going into a 4-story, 80,000 square foot facility, so a large facility at the National Harbor. And what's exciting about it is that it's attracting providers who have been successful in their practices elsewhere into the county, and those providers will bring their patients back, many of whom are residents of the county already. And I think it's a model for how we have to do public-private sector partnerships in order to provide what our residents need in the healthcare sector.
Yeah, you mentioned something that's really dear to my heart. I talk a lot about bringing our folks home, right? We want to make sure that those who are looking for health care outside of the county are coming back to this county for those services. We talk a lot about that, also about jobs as well. So many of our residents have been traveling outside of Prince George's County for jobs, bringing those jobs back home. As I like to tell people, we want to keep everyone here and spending their dollars here, actually, in the county and investing here, here in Prince George's County. In addition to the social determinants of health that you talk a little bit about to us, and I know we're going to be closing out in just a few minutes. Talk to me a little bit about the health disparities, health equity that we focus in a lot, because I think that's a key direction that this county council is interested in going in, making sure that we really have that primary care health network we spoke about.
Yes, absolutely, and this is a very important dialogue that I'm so glad that the county council is addressing not only health equity but equity across the board. And when you have inequity is when you have health disparities, and we don't have time to get into a long conversation about it, but probably one of the most sensitive measures that I worry about a lot is infant mortality and maternal mortality. There should not be differences with regard to the experiences that women of childbearing age have, either with their own mortality when delivering a baby or the mortality of the infants that they deliver. And this is just an example of where a rising tide floats all boats, where if we do better across the board, these metrics will improve.
Well, I'll just, as we close out, I'll just share with folks that the County Council meets multiple times throughout the year as the Board of Health. All of those meetings are available on our website. That's pgccouncil.us. And so you can find any of our previous presentations. We have the University of Maryland Medical System in really regularly. In fact, I think they're coming into every one of our Board of Health meetings to keep us updated in the progress in the hospital as we get to opening in 2021. With that, I just want to thank Dr. Gourdine and Dr. Wright for being my guests today, and really for being such great partners as we work together to improve healthcare and healthcare delivery in our county. Council Connection, Together Strengthening Our Communities, is a production of the Prince George's County Council. Thank you for joining me. I'm Council Chair Dannielle Glaros. Stay connected.